G'day there, Chris from the Headache and Pain Management Centre for another video for National Headache and Migraine Week. Today what we're talking about is one of the bigger mistakes that can be made by someone who lives with headache and migraine when it comes to their treatment. And today I'll be sharing that one with you. So stick around and we'll get some solutions for you. Now, it's really important when you are seeking a solution for your headache or migraine condition that assessment and diagnosis is key, that you need to work out what the cause or the, direction that you need to go in early on so you're not wasting your time and your precious money. Basically, what needs to happen right from the get-go is that it needs to be a process of testing and measuring to make sure that the treatment that you're getting is right for you. Now, here's the kicker. Some health professionals that you see out there, some physios, some chiro, some doctors even, some of them are what I would call one-trick ponies, okay? And what do I mean by one-trick ponies? Well, these are health professionals that are very, very good at treating you or assessing you in one way. Okay, so there might be one drug that they prescribe to everybody. There might be one recipe type approach that's developed by a physio or a chiropractor to treat your headache or migraine condition. Different headache approaches, different methods of doing things. Now, what's important about this is that ethically, the health professional that you're seeing should be sort of telling you right from the get-go, this is what we're doing. If this works, then great. If it doesn't work, then it doesn't work. This is what I do. This is how I operate. We're going to give it this long to give it a bit of a go. Okay, now ethically, that's what they should be saying. But what I've seen over the years, and I've been in it a long time now with headache and migraine, that quite often people are doing the same thing over and over again and expecting a different result. And the exception, of course, is for those with conditions that just need to be managed, that can't be sorted all the way through. But if there are things that can be sorted all the way through and not reaching the point where you're happy, then you need to talk to your health professional about what the next steps could be, because really there should be changes with any new session, any new treatment within 2 weeks and certainly within 4 weeks in terms of symptomatic relief or an increase in function or an increase in strength. Or at the very least, there should be an extremely good explanation coming your way as to why not, and basically telling you what is expected to happen over a sort of a medium term thing. So how do you know if your health professional knows what the next step is? Well, the best thing that you can do as a patient is to ask, what if this doesn't work? Okay, what if this doesn't work? All right. Now, if they're worth their, if they're worth their weight, if they're ethical, basically what they'll say is, well, if it doesn't work, we'll give it a crack for this long, and if it's not working, then I'll refer you to someone who can try something else. That is the most ethical answer. The last thing that you want to be doing is going to the same person 3 times a week for many, many weeks or months and not getting any relief whatsoever. That's just a waste of everybody's time. So if that's happening, you need to ask the question, what can I do next because it's not getting better, or what if this does not work? Okay, so you need to be upfront and have the bravery and courage to ask a health professional about that, because you never know, they might actually have something else there in their toolkit to help things through, but they don't know unless you do actually bring it up with them. So that's something that you need to do if you're in that situation. Now, to let you know, here at the Headache and Pain Management Centre, what we do is that we're kind of obsessed with headache and migraine here. So we've been trained in a whole gamut of different things to look at, to assess, to treat, to diagnose, to get things in the right direction. So various headache approaches from different schools of thought within physiotherapy. So both the standard university training and extra courses as well, which are sort of postgraduate teaching courses that we have all gone on. And we've developed that into a really nice system, a really nice package of ways and means to work out who will be best for which type of treatment at the very beginning of your treatment plan. Okay, so we talk through that on day one with you. We assess the joints, the muscles, the nerves, the discs, and also the brain's relationship with how pain works as well, which is something not everybody does. So we've been told that that's a very unique way of looking at things. So we've got a whole gamut of different things that we can assess on day one, and then we'll always tell you about what the treatment methodologies are, whether they be joint mobilizations, whether it be a bit of bouncing on the joints, whether it's sustained, whether it's muscle massage, whether it's trigger point releases, perhaps even some dry needling, perhaps some strength, perhaps even some pain education as well. It all depends on who you are, what your individual headache or migraine picture is, and then it's tailored towards you to get the best result possible. We will always tell you on day one if we can help you out and how we will help you out. And if we can't, then we'll refer you on to someone who might have the answers for you. Okay, that's our promise to you, that we will tell you if or how we can sort things out and then refer you on if we cannot. We're not going to waste your time. We're not going to lead you down a garden path. We are not going to waste your time. On day one, we're very upfront with our treatment plan. We tell you how long it's going to take, okay? So sometimes it can be a little bit forthcoming when we do say that it will take a little while to get where we need to get to. I haven't written a book on muscle physiology. That was God's work, okay? It does take 12 weeks for muscles to strengthen. So if it is a strength program, then 12 weeks can be somewhere in the vicinity of how long it takes. Other people, it might be something relatively minor or relatively quick to fix, and it can take as little as 2 to 4 weeks to get that sorted out. But really, it all comes down to day one, making sure that you're talking to someone who knows what they're talking about, what they're looking for, and can give you an accurate diagnosis, an accurate treatment plan, a treatment plan that's adaptive, a treatment plan where you can test and measure the results on the way through. So yes, I hope that's been helpful. I know that there's a lot of people that have tried a lot of things for their headaches and migraines out there, and I'm hoping just to cut through and give you a bit of an idea as to how to sort things out. In fact, I've actually written a book here called Choosing Your Ideal Health Professional to give you a bit of a gauge as to who might be the best person to see, whether it's a physio, a chiro, a doctor, whoever it might be, to talk to about your headache and migraine. If you do want a copy of that, just type in booklet in the comments below, and we'll be more than happy to shoot that one out to you to have a read of, to consider, to see what the next steps could be for you. Hey, I hope that's been really helpful for National Headache and Migraine Week. We're talking about the neck and its relationship to headache and migraine this week. We'll be back with another video tomorrow, so I hope you can join us then. Cheers and bye for now.